What is alopecia from breast cancer chemotherapy? Alopecia from breast cancer chemotherapy refers to hair loss resulting from the effects of chemotherapy drugs used in treatment. These drugs target rapidly dividing cells, which include not only cancer cells but also healthy cells, particularly those in hair follicles. This can lead to hair loss that may be partial or complete, typically starting within a few weeks after beginning chemotherapy. Chemotherapy-induced alopecia is one of the most common side effects experienced by patients undergoing treatment for breast cancer. Research indicates that it affects around 65% or more of these patients. Hair loss usually occurs quickly during treatment and primarily affects the scalp, but it can also impact eyebrows, eyelashes, and body hair. Most of the time, hair loss from chemotherapy is temporary. Regrowth often begins weeks to months after treatment ends. However, in some cases, alopecia can persist long after chemotherapy is completed. This condition is known as persistent or permanent chemotherapy-induced alopecia. Studies show that this can occur in approximately 10 to 30% of breast cancer survivors, particularly those who received taxane-based regimens, such as paclitaxel or docetaxel, or chemotherapy that includes cyclophosphamide. The mechanism behind chemotherapy-induced alopecia involves damage to the hair follicle cells. This is especially true for the rapidly dividing cells in the hair bulb during the growth phase of hair. Persistent alopecia may result from injury to the hair follicle stem cells or disruptions in the pathways that regulate hair growth. This can lead to miniaturization of hair follicles, similar to what occurs in androgenetic hair loss. Clinically, persistent alopecia after chemotherapy often presents as diffuse thinning or pattern hair loss. Some treatments used for androgenetic alopecia, like topical minoxidil or anti-androgen therapies, may help. However, some patients may experience inflammatory or scarring alopecia, which requires different management strategies. The impact of hair loss from chemotherapy on quality of life can be significant for breast cancer patients. It can affect self-image and emotional well-being. Women who continue to work during treatment or who have not undergone mastectomy may experience greater distress related to their hair loss. In summary, alopecia from breast cancer chemotherapy is a common side effect caused by damage to hair follicle cells. While it is usually reversible, some patients may experience long-term or permanent hair thinning or loss, especially after taxane-based treatments. Management can include supportive care, cosmetic options, and sometimes medical treatments to promote hair regrowth. It is essential for patients to discuss their concerns and options with their healthcare team to receive personalized advice and support.